Stability, exploring housing supports in Los Angeles County. My name is Marlene Cole. I'm a program officer at First 5 LA and a co-lead for the Home Visiting Consortium's Referrals Workgroup. I'm joined by a fabulous team who helped to organize today's panel. Anna Gukassian, Laurel Murray, and Lynette Marquez from LA Best Babies Network, and Melina Ramirez from Maternal Child Health Access, my co-lead for the Referrals Workgroup. The Home Visiting Consortium's Referrals Workgroup organized this panel after our two most recent referrals barrier surveys revealed that housing was the #1 referral challenge experienced by home visitors in our network. We reached out to your programs, and when you responded to the invitation for today's webinar, you included some of your most pressing questions and challenges. Please advance to the next slide. Thank you. So I'm going to go over the objectives for today's webinar, but first I'd like to kind of read to you our purpose of our referrals work group, which is to support member organizations, home visiting staff, and service providers to strengthen pathways and linkages for families to the community resources that they need and the home visiting program that is the best fit for them, and advocate for systemic improvements to eligibility and access. And it's been a group effort. So even though I named LA's Best Babies Network and Melina, we have a lot of work group members who all played a hand in making today's webinar happen. So what we hope that you will get out of today is you'll learn about the steps involved in the application process, eligibility criteria, and documents needed to apply for crisis housing, including eviction prevention or rental assistance. You'll make one new housing-related connection or identify one new housing-related resource, including contact information for home visiting clients. We'd like you to learn about one workaround or alternative way to support a client in need of housing when there are no slots or resources available. You'll learn about how DPSS and the Coordinated Entry System agencies can assist clients experiencing a housing crisis with motel vouchers, shelters, rent support, or other short-term assistance to remain housed or to secure housing. And while we originally thought about doing an open Q&A session, we have too many participants. We actually have over 200 people participating today. So instead, we will offer you the opportunity to put questions in a Q&A box and submit a question for our panelists when you submit your evaluation at the end of the webinar. And I have some preset questions based on all the information you gave us beforehand. And now I will give you a little bit more information about what we'll be doing today. So Lynette will be introducing all of our panelists. Then we'll follow that with a moderated Q&A session. And Melina will provide a demonstration of how to use the LA Affordable and Accessible Housing Registry. At the end, we'll have a brief open forum, which will include a Mentimeter activity and an evaluation of today's session. So now I'm going to pass it to Lynette, who is going to introduce you to our panelists.
Good morning, everyone. So our first panelist is from HOPICS. Let me advance the slides. Okay, our first panelist is from HOPICS. We have Regina J. Windley, a program manager at HOPICS. She has previously worked as a family response team specialist, providing direct services to families who are experiencing homelessness. And we also have Diamond Dennis with us, and she is a family response team lead. So I will hand it over to them.
Thank you so much, Lynette. Welcome, everybody. So I will give you a brief overview of HOPICS Family Solution Center. And most of our services can be found all over Los Angeles County with other spas and other family solution centers. Okay, next slide, please. Thank you. So HOPICS FSC is HOPICS Family Solution Center. We're located in Los Angeles, Spa 6. Our address is 5849 Crocker Street, Los Angeles, California. However, the building is rather large, and the Family Solution Center entrance is opposite of the Crocker address. So the entrance is directly on Slauson Avenue and San Pedro Street. Next slide, please. What services are offered at HOPICS? Well, we offer many different services, including emergency shelter for families, move-in assistance for families, rental assistance, eviction prevention, time-limited subsidy, linkages to DPSS, employment assistance, child care resources, including Crystal Stairs, safe parking, mental health, benefits through CBEST, legal aid, assistance with education for through LA Unified School District, but also for adults who may be seeking vocational education programs, and many, many more other additional resources and services. Next slide, please. To be eligible for services at any Family Solution Center are two very simple things. One, a client must be experiencing homelessness or be at risk of homelessness. And two, you must have a minor child in the family dynamic, or an individual must be pregnant with child, expecting, in order to receive services at the FSC. Next slide, please. What is the referral process for HOPICS? Now, I do believe that the referral process for FSCs may vary, but there are two components that remain the same across all FSCs, which are that the clients, if they are expecting emergency shelter, that they must come in document ready. Documents that are considered important for the intake process or the screening process include proof of income, children's birth certificates, some sort of proof of parentage, the adults' IDs, and social security cards for every family members, and also immunization records if you have it. Now, if you don't have all of these documents, it is completely okay. The most important two are some sort of proof of parentage and an ID, so we can verify your identity pretty much. For HOPICS specifically, we receive walk-ins Monday through Friday at 8:30 a.m. Of course, we always suggest that our clients come in a little bit earlier because our services are first come, first serve, specifically for emergency shelter. But again, we do move-in assistance, all types of permanent housing assistance, and many different services as well. If you're referring a client to HOPICS FSC, you can complete the 1166 LASA referral form for FSCs and send them directly to the HOPICS FSC email. Next slide, please. Here's our contact information, the direct line to the family response team to be received by the family response team. Call center representatives is here listed in the slides. Also, our referral email is very simple, fsc@hopics.org. And my email, if you do need to reach out, is rwinley@hopics.org. Thank you.
And now we have Eric Sanchez. He is a program manager in the eviction prevention program at HOPICS. So I'll hand it over to him.
They're looking. Hello, everybody. Sorry about that. Alrighty, so thank you all for joining. We are here with the eviction prevention program. And we will, can I get the next slide, please? Thank you. So here's a little overview about what we'll be able to cover right now. We have the goal of the eviction prevention program, a couple of our eligibility requirements, imminent risk of homelessness, a couple examples, our typical enrollment procedures, enrollment options, range of services, and our services and promise. So overall, our goal of eviction is to address immediate housing crises of individuals and families who are at risk of becoming homeless. Our prevention services offer anything from rental arrears, rental assistance, and locating and obtaining alternative permanent housing, with the goal of it having stabilized housing situations and being able to maintain rental payments. A couple of our eligibility requirements: at or below a 50% average median income determined by our LASA accreditations. We have a targeting tool that allows us to determine how much services are being able to administer per client situation. We usually will accommodate and allocate as many services as possible. This score is not determinative of how much service you will receive from us. It is just determinative of how and what range we can utilize all our resources. Imminently at risk of homelessness or fleeing domestic violence are situations that make you eligible for our programs. Receiving unlawful detainers, notices to vacate, and any sort of numbered day notice. Couple of the paperwork that we require to ensure that we are able to process clients effectively is tenant ledgers, lease agreements, income verifications, anything within the last 30 days from our enrollment date, and anything with non-consistent income will require about 90 days worth of income verification. And of course, a proof of hardship, just to demonstrate that what kind of services we will be able to unlock and use for you. Couple of examples of the notices we ask for. We are here. You have a notice to vacate. You have the the 3-day notice to quit, and a couple of the jury and court documents that also will qualify you for our program. Our enrollment procedures: initially, we begin with a walk-in initial screening triage where you meet with our FRT team, and they kind of essentially go over our programs, what other options we have for resources available within the program and our organization, ensuring that you have all the required documentation, and we'll can schedule you on with our case managers based upon availability. And now certain circumstances require sooner responses, and our FRT team will be able to manage and schedule those accordingly. They will also ensure that once you get to the next scheduled appointment with our case managers, you will be able to be processed as quickly with having all the paperwork. With the case managers, you will also be developing housing service plans and essentially assessing the situation, how we can move forward with the services that we provide, and ensuring that even beyond our services, if you need anything from our end or support in independently having housing situations under control. We have two programs for our eviction prevention program. One is families must be composed of at least one adult and one child under the age of 18. Other households that only have adults will be considered under our individuals program. Range of services, it can vary. We understand that there are many phases of eviction that can be behind rental arrears, utilities, other expenses that could cause and damper the inability to pay rent. So we can go anywhere from rental arrears assistance, which is past due balances, rental assistance, which is a certain allotted months from the moment we do our enrollment and moving months forward, security deposit assistance in some instances where we can support a move out of a housing into a new location. Utility arrears, past due balances of water, gas, electricity, power, utility assistance, and the other side of that is going forward. If you need assistance paying months ahead, we can work on the servicing plans for that. Any amount, certain amounts of legal fees if we have to sustain legal counsel, or if you need legal counsel to represent in court. Moving expenses if we are in certain areas or situations where we must be able to support our clients in moving into different housing situations. And one of our resources that we can also be unlocked is temporary hotel and motel stays while we assist with finding new housing situations for our clients. This is a little glimpse of our services and promise. We are deeply committed to addressing the pressing issue of homelessness in our communities, and with sincerity and unwavering dedication, we strive to provide comprehensive support and services to those in need. While our resources are situation-based and subject to availability, we promise to diligently assess each individual circumstances to offer the most effective assistance possible, while ensuring we connect and assist as many houses as we can. Our goal is to maximize the resources allocated for every client who walks through our doors, ensuring that we offer the highest level of care and support within our capacity. We are devoted to making a meaningful impact and fostering hope, stability, and a brighter future for everyone. My name is Eric, Program Manager for Eviction Prevention. This is my information if you want to take a picture, screenshot, or contact me at any times during the week. Thank you.
Thank you, Eric, and thank you, Regina, for joining us today. So our next panelist is from Harbor Interfaith. We have Sharon Stewart. She is the VP of CES at Harbor Interfaith Services. She currently oversees the coordinated entry system and has over 15 years of experience in homeless services. So I'll hand it over to her.
Good morning, everyone. So again, I'm Sharon Stewart from Harbor Interfaith Services. And we are actually the lead agency for the coordinated entry system for SPA 8. So we are the lead agency for the family, youth, and individual system. And so just a little bit of background regarding Harbor Interfaith Services. It was established in 1987, and it stems from two organizations that came together to see how they could meet the needs of the low-income individuals and homeless people in the community. And so it was a food pantry that started in 1975 and a shelter that started in 1983. They decided to come together to work together to ensure that they can use those resources to help the community. So in 1987, Harbor Interfaith Services was born. So the agency has increased their services over time. So they continue to have a food pantry. And the food pantry is able to supply a 3-day supply of groceries to anyone that comes in, and donate clothing, also provides hygiene items. And it's actually operated by volunteers. So annually we have about 75 volunteers that come in and will sort the groceries, distribute the groceries, and stock the shelves when needed. We also provide holiday food baskets during Thanksgiving and Christmas. And during that time, we actually distribute over 700 baskets during that time to the families in the community and the families in need. We also provide services for seniors. So if a family or a senior wants groceries and is unable to get to our agency, we do provide transportation for them to come to and from our agency to pick up whatever they need, whether it be groceries or any hygiene products. We have a family shelter. It's a 20-bed shelter, and each family has their own space. It's almost like a small studio. And if we have larger families, we're able to put bunk beds or cots into that particular unit so that we can house larger size families. We also have a transitional housing program, and the unique thing about our transitional housing program is that it's education-based. So it's for families that are seeking higher education, doing a course that can be completed within 12 to 18 months. And during that time, they'll go to school, they'll get that higher education or that certification, and they will also be required to pay 30% of their income towards the rent. And this kind of gets them in the mode of, when they're out of that program, that there is the responsibility to pay rent moving forward. We do also have a licensed childcare center, and we're able to provide childcare services for children 6 weeks of age to 17 years of age. Next slide, please. So again, we are the lead agency in SPA 8, and we're located in San Pedro. And the main purpose of the coordinated entry system is to connect people experiencing a housing crisis to resources as quickly and efficiently and with equity. The CES is organized by a set of or network of service providers and system funders across LA County to coordinate resources so that we can address the needs of the population immediately and leverage all the resources that are available. Each SPA has a lead agency, and each agent or each SPA has an access point. So it's an either access center or an FSC or family solution center where individuals and families can go and receive services at those points. Some lead agencies may have subcontractors, so there might be multiple access centers or FSCs that you can visit at that time. One of the important things about the coordinated entry system that it is client choice. And so that means that a client can choose to be serviced at any FSC or access service area that they desire. Even if they were, say, living in Lancaster and they became homeless in Lancaster, their family lived in Lancaster, if they decided that they no longer wanted to be in that community and wanted to maybe go to San Pedro or Santa Monica, they have the choice to do that. As long as there's a capacity at that FSC, that FSC is able to provide services to them. So the services that are provided through the coordinated entry system are problem solving. And this is basically meeting with the individual or family to see if we can develop strategies for them to work out their problem on their own rather than coming into the homeless system. If that's unable to be resolved on the front end, then, and they are actually homeless, we do have interim housing that they can move into. That would either be a motel room or shelter. Once the family is in the shelter or the motel, we will start working with the family to find housing, because the ultimate goal of the coordinated entry system is to place families into permanent housing. And so they will be connected to a housing navigation case manager who will work with them to make sure that they do have all their documents ready in case they're matched to a permanent supportive housing unit, or just to get into housing. So they'll take them on housing visits, they'll help them with the application fees, and work with them diligently to find housing that suits their needs. If that particular family wants ongoing or needs ongoing assistance, then they will be enrolled into the time-limited subsidy program. And that's where they're assigned to a case manager that will be responsible for their ongoing rent and also help them to retain the unit that they're in. So they'll connect them to resources, to employment, to whatever resources that they connect them to, that family remains housed. They'll conduct home visits. If the family is having problems with their unit, they'll be able to mediate with the landlord for them. So their main goal is to make sure that once the family is in this housing, that they stay in housing and they're able to sustain it moving forward. Again, we are able to connect families to permanent supportive housing, and that's based on acuity. So when families or individuals come in, they'll complete an assessment form, and based on the acuity score, that will deem the family or individual eligible for a permanent supportive housing unit. As mentioned before, the coordinated entry system also has prevention services. So any family or individual that's experienced a housing crisis where they may lose their housing, this program will allow them to come in and help hopefully get the services needed to make sure that they remain housed, so they're able to pay the arrears and pass through utilities or even move them to a new unit if needed. Under the coordinated entry system too, families do have access to mental health and substance abuse counseling. So every time a family comes in, we automatically refer them to those two programs. And if the family feels that they need those programs, they can take advantage of them as well. In addition, we do have an education liaison specialist that helps to remove any barriers that the family may have to enrolling their child in school or going to a particular school, and also providing them with backpacks and school supplies if needed. And finally, we are finally connected to DPSS, who is one of the major partners in the coordinated entry system, And through the DPSS, we're able to assist families with, getting access to additional benefits or enrolling in benefits, and also making sure that, whatever leverages we can use as far as motel assistance, we can utilize through DPSS as well. Next slide, please. So thank you. Again, I'm Sharon Stewart. My contact number is on the slide, along with my email and the website for our organization. Thank you for joining today.
Thank you, Sharon. I'm going to introduce our next speaker. Let me just share my screen real quickly. Okay, our next speaker is from LA Family Housing. We have Tiffany Brooks with us. She is the Director of Regional Coordination for SPA 2, and she has over 24 years of experience in social services, with 8 of those working in homelessness programs. So I will hand it over to her.
Hi, good morning, everyone. Thank you for joining us today to discuss this most important topic. So I didn't get in too much of a PowerPoint because, quite frankly, all of us who are funded by LAHSA essentially have some of the same requirements to get into our programs. So again, my name is Tiffany Franklin. I am the Director of Regional Coordination for SPA 2 at LA Family Housing. We are located at 7843 Lankershim Boulevard in North Hollywood. We are the lead agency in SPA 2 for the individual and family systems. However, we do serve all of LA County. As you see here on the screen, some of the services that we provide are access and engagement. We have street outreach teams. We also have interim housing sites, a housing navigation program, a TLS program, which is also known as a time-limited subsidy, which is a rental subsidy. The problem-solving program, which helps families and just individuals, quite frankly, not enter the coordinated entry system. That's really to divert people from the system. And then, of course, PSH buildings, which stands for Permanent Supportive Housing Buildings. So those are for our more high acute individuals that need that higher level of care with on-site intensive case management services. So I'm very happy to be here. I'm very much looking forward to the discussion. My contact information is on the screen, as you can see. Feel free to reach out to me with any questions, and I'm looking forward to our conversation. Thank you very much.
Thank you, Tiffany. Okay, our next speaker is Diana Dudar. She works at the community as a community partnership program manager for the LA County Department of Housing's Housing Homelessness Prevention Unit. She has over 7 years of direct service experience supporting vulnerable populations who are at risk of homelessness. So I'll hand it over to you, Diana.
Good morning. Thank you so much. I'll go ahead and get started. My name is Diana Dudar. As mentioned, I am the Community Partnership Program Manager here at the Homeless Prevention Unit. Next slide, if you could. So getting a little bit into our program, we are a pilot program that launched in 2021 in partnership with UCLA's California Policy Lab and the Department of Health Services, as well as the Department of Mental Health at LA County. We are a proactive, super data-driven prevention program serving all of LA County. So we find our clients using a predictive model, very well known as AI, that runs on all this data gathered from 7 county agencies. So the people coming into our program are high utilizers of county services and systems. So people going into emergency rooms a lot, receiving crisis stabilization holds for their mental health frequently, getting arrested frequently, receiving benefits like food aid. All of that data feeds into an algorithm that essentially spits out a list of clients that we then reach out to, because we know folks having these interactions are the same people who within the next 12 months are going to lose their housing and appear in the homeless services system. So our goal is to essentially prevent that and stop that and stabilize them enough to where they're able to continue living in safe and affordable housing. We meet our clients in all stages of precarious housing situations. So some of the folks we proactively call will let us know that they just got an eviction notice from their landlord. Our goal is to do whatever we can to appear in their lives and help them stabilize. Sometimes that means that they remain in their existing housing and we find ways to help them stabilize there. And other times there is a need for relocation, and this is where our housing navigator services come in. We have a full-time navigator that is dedicated to clients in need of relocation that will then work with those clients to find secure, affordable housing that meets their needs. Our intervention includes 4 to 6 months of ICMS services and very flexible and significant in scale financial assistance for our clients, starting with a minimum of $4,000. So the funds available are primarily there to help increase our client stability in whatever way that we can. The financial assistance goes towards housing related items such as rental arrears, relocation fees, security deposits, first and last, mortgages, but we also pay off people's credit card bills. We pay off student loans. We support clients in buying cars or fixing their current car that they have. Whatever our clients need, we try to handle with the financial assistance as long as it's geared towards their housing stability. Alongside that, we also provide assistance with connecting our clients to support services like mental health providers, doctors, legal services, immigration services, parent support services, you name it. We likely try to have those pathways available for our clients, meeting all different unique situations that they may, come through our doors with. We really try to meet them where they're at, try to fill in those gaps, and essentially just put them back on the trajectory towards housing stability. Fortunately, our data has shown that our program has helped well over 800 of individuals and families in Los Angeles County at risk of becoming homeless, with about 87% of our participants retaining permanent housing after their discharge from our program. The biggest ask is often how clients could providers can refer their clients or how people could get enrolled into our program. However, because our program is piloted, we have to follow the model to see if it works. And that is just based off of, again, the list that we receive of the names that are collected from this algorithm. So we currently do not take referrals at this time, but I am still here today to just kind of discuss the efforts that we do implement into our program, to share with y'all that are attending today, in hopes that maybe you guys could take some knowledge and some of the resources that we oftentimes use. Also, if your client ever gets reached out by us, you could always affirm to them that we are legitimate. Oftentimes, our program raises a lot of eyebrows when it comes to the outreach calls that we make to our clients. Given that we are very low barrier, there is often the presumption that we are a scam or it's either just too good to be true. So having other providers kind of verify of our program's legitimacy also oftentimes helps us when it comes to enrollment. And oftentimes in these spaces, when we are connecting with other direct service providers, we're more than likely serving the same population of clients. So it's not unlikely that we may come across a client of yours that is also on our list, and also gets to work with not just you, but with us as well. Next slide, please. As far as the key features for the HPU program, again, we are a short-term program, so things move fairly fast. We are low barrier. As far as eligibility, all that it takes is for a client to, 1, be on our list, and 2, live within LA County, and 3, they have to be housed. Again, all different levels of housing, but they do still have to be housed. Our case managers work with a fairly low caseload size. We have 10 case managers serving single adults and 10 case managers serving families. We also have a pretty full-on staff specified, like the linkage program manager, housing navigator, a full outreach team, and a data team that is constantly collecting data mining information, flexible financial assistance, and always considering equity across the board when it comes to serving our clients. Apologies, I did not add my contact information, but I'll be happy to share that some way, somehow, if anybody has any questions or interest in just kind of learning more about the program. That's it on my end. Thank you.
Thank you, Diana, for being here with us today. And I will hand it over to our last panelist, who is from the CalWorks Family Homeless Assistance Program. We have Ana Ibanez here with us today. She's a program assistant with the LA Department of Public Social Services and has been with CalWorks for 8 years and with the county for over 19 years. And I will hand it over to her.
Thank you. Good morning, everybody. So as mentioned, I'm here from CalWorks program to present on our different housing programs that we offer under the CalWorks umbrella through DPSS. Next slide, please. So we do offer 7 different homeless assistance programs for our CalWorks families. 3 of our programs are state programs that we administer, which means that the state implements the policy for those programs. We just administer them to our DPSS clients here in LA County. So these state programs are Temporary Homeless Assistance Program, which offers 16 days of temporary shelter payments. Under that program, there is an expanded temporary HA program that is exclusive to any of our families who are fleeing domestic violence. And this program provides up to 32 days lump sum issuance to obtain temporary shelter. We also have our Permanent Homeless Assistance Program, which helps our families secure permanent housing by allowing them an issuance to cover their deposit costs or utility deposit costs for gas, electricity, and or water. Under that, we have the Permanent HA Arrearages Program, and this helps our families who have fallen behind on their rent and will cover up to 2 months of their past due rent to help prevent that eviction. 4 of our county supplemental programs have been implemented to supplement the state programs. For example, the Temporary Homeless Assistance Program Plus 14, TAP Plus 14, is just an extension of the state's Temp HA program and offers an additional 14 days of temporary shelter payments for our participants. Our Moving Assistance Program allows our participants with moving costs, including security deposit, truck rental fees, utility turn-on fees, and assistance to help purchase a refrigerator and or stove. Also, we have the Emergency Assistance to Prevent Eviction Program, or EAPE program, which helps our CalWorks families with assistance to pay their past due rent and or utilities to prevent an eviction. So this is an extension of the state Permanent HA Arrearages Program. Finally, we have the 4-month rental assistance program, or 4-month RA program, which is a rental subsidy for our CalWorks families and provides them up to 4 months of rental assistance. So again, the state CalWorks HA programs are available throughout the state of California, which means that other counties also administer these programs, including LA County. So other participants from other counties can go to their own county, wherever they reside in, and request those 3 state programs within their county. Our county supplemental HA programs are exclusive to LA County families who are on CalWorks and are participating in our Welfare to Work programs. So these are exclusive to LA counties. We've implemented these programs as an extension to the state HA programs and are only available within LA County. Next slide, please. State HA programs are available once every 12 months with the following exceptions. A state or federally declared disaster has to be the direct and primary cause of the family's homelessness. For example, here in California, we see, it's very common to see wildfires and sometimes earthquakes. So if this has become a federally declared disaster, this is one access point within the 12-month period as an exemption to the program. Also, if our family is a victim of domestic violence, that's another exception. If their former residence has become uninhabitable, and also if they are experiencing physical or mental illness. County supplemental HA programs are available once in a lifetime with some exceptions, and these exceptions mirror the state exceptions that I just listed off. Next slide, please. Through DPSS, we also offer our Homeless Case Manager Services, our HCM program, which are gain service workers that are located within our 19 CalWorks district offices throughout LA County. And these are specifically homeless case managers that are there to provide case management to homeless or at risk of becoming homeless families applying for or already receiving CalWorks. Homeless case management is a volunteer program for families who are homeless or are at risk. and provides the following services, which are crisis intervention, short-term stabilization, assistance with locating a hotel motel when the participant needs a temporary shelter, need assessment, assistance with resolution or financial or program-related imposed sanctions and penalties. This is in direct relation to our GAIN program. So for example, if our family is not connected with the GAIN program, and of course, to be able to access our county supplemental programs, they need to be participating in the Welfare to Work program. So our HCMs, being GAIN service workers, can directly link them to their GSW to check off that participation box. GAIN, actually our HCM program also offers assistance with application receipt of specialized supported services, which is also offered through the GAIN program. Assistance with participation in GAIN when the at-risk or homeless family is requesting benefits. Again, this touches upon that participation rule for our county supplemental programs. Next slide, please. So just to reiterate or kind of just mention something very important, that with a DPSS, we do not offer permanent housing or temporary housing to our participants. We offer that assistance for our eligible participants to secure temporary or permanent housing on their own. So they must find affordable housing on their own for us to be able to assist them, but we never place them in any type of temporary shelter or permanent housing. I just feel I need to mention that because that's somewhat of a misconception that some of our participants have when calling for our services. They somewhat sort of expect to be placed in some kind of temporary shelter or permanent house right away, but that's something that DPSS will never offer to them. We can assist them with the monetary issuance, but never with the physical temporary or permanent home. And that's it. Thank you so much.
Thank you, Anna, and a big thank you to all of our panelists for being here with us today. We appreciate you sharing your time, your expertise, and any resources with all of our participants today. And now I will hand it over to Marlene for the next part of our webinar.
Thank you so much. And thank you again to all of our speakers. I have been reading your questions, and we actually received a lot of questions when you registered as well. So I'm going to try to be fair and ask as many of them as possible. And originally I had them directed to individuals, but I think I'm going to make it more flexible. So whoever feels like you have a good, strong answer, just feel free to jump in. So we did get a lot of questions about how to help clients who are not here legally. So if their families are, or the parents are undocumented. I know that the Office of Immigrant Affairs has some services available. Can someone speak to resources for these families?
I'll jump in, Marlene.
Thank you.
So I can tell you that the coordinated entry system does serve undocumented families. It becomes a little trickier when they try to apply for subsidized housing because it is federally, because it is federal funds. What typically happens is they will fund, so say if you have like a mixed family where maybe the parents are not legal residents, but the kids are. So let's give an example of two parents and two kids. They will subsidize the children because they are citizens, but they will not subsidize the parents. And so what usually happens, or what I've seen in my experience, is that oftentimes the subsidy that is offered is still not enough for the family to be able to afford the unit. So in essence, it helps, but yet it doesn't. So that's kind of the catch-22 with that. And I don't know if my colleagues have more that they can add to that.
Hi, this is Anna from DPSS. So it's somewhat of the same answer. Because CalWORKs is federally funded as well, a family can obtain CalWORKs for their kids if the parents are on doc. So as long as they have an active, open CalWORKs case, they are eligible to our homeless assistance programs. through the kids. So they obtain that linkage through the kids from CalWorks, from being eligible on CalWorks. They'll be able to assist with homeless assistance for the kids as well. And again, I'm sorry. And again, just like Tiffany mentioned, most of the time, the issuances and the limitations on our issuances sometimes are not enough. As we know, inflation is, super high right now, where what we offer for temporary shelter, which is $85 a night, most of the time is not enough. So it's up to our families to make that last as long as possible. But in general, it's the same issues that Tiffany at LA Family Housing is seeing. We're seeing here through DPSS. Sometimes it's just not enough, and they're doing what they can with the issuances.
I would also like to add, like,
sorry. No, go ahead, Tiffany.
The Office of Immigrant Affairs, they provide a lot of assistance there. And then with the influx of migrants that we're receiving, there are some, I don't want to say policies. Policies is not the correct word, but there are some new resources coming online. And so, Marlene, I can share that with you afterwards, so that way you can share with, with all the attendees.
Great, thank you so much. We'll make sure we include it in our post-session email to everyone. Can someone talk about resources that are available for families who they have housing, but they're living in substandard housing? So for example, they have mold or they have vermin. What kind of resources are available to them to get help with that?
We typically refer our participants to neighborhood legal services. I would say that housing laws are being taken seriously right now. Tenant, what do you call that? Not responsibilities, but tenant rights, tenant rights are being taken seriously right now, especially because of the housing crisis. So landlords are really being held responsible. And I can tell you that the law is coming down on them to maintain safe and sanitary housing. Obviously we know that some people fall through the cracks, right? As with everything, a lot of our systems are stretched, but I can tell you that places like neighborhood legal services or other agencies that provide free legal services are taking on housing issues, and we are finding that tenants are winning.
One thing our program also does, alongside what Tiffany is mentioning, is we refer them to legal services that offer free support, consultations, and representations from time to time. Sometimes we'll provide our clients with the Department of Public Health complaint form. You are able to submit a request, whether it is, I believe, like a unit, a home, or even a business. If there is some kind of health or safety concern, you could put in a submission, and I believe within 48 hours, somebody may go in and evaluate the habitability and just the safety of, again, the unit, and could possibly just move a little bit further into the process of getting the landlord to resolve the issue if that's the case. So it's something we oftentimes also provide the clients. The complaint form could also be anonymous as well, if that's what they wish.
Thank you. Good to know that that form could be anonymous. I know that that's probably a concern for some families. So we got this question submitted in advance. How to help families who need emergency housing, but it's like a Friday afternoon or it's a weekend? What do you recommend home visitors do to help their clients in these situations?
Hi, this is Shan from Harbour Interfaith. So I think the main thing is that if it's Friday afternoon after hours, the main resource is 211. And 211 is the agency that's able to provide after hours motel assistance if available, or any other resource. But if they come in slightly before 5 a.m., they might be able to catch the FSC and do a quick screen and then be issued a motel voucher if that's available too. So it really depends, but more than likely, if it's after hours, their main resource would be to connect with 211 to get access to a motel stay for that weekend.
And can I piggyback on that? If the family is literally homeless, they're in a tent, they're living in their car, they're somewhere, you can also utilize LA HOP. That's the Los Angeles Homeless Outreach Portal. And you can report you can report the person who's experiencing homelessness there, and we have weekend outreach teams that will respond. And that's lahop.org, I believe. And I believe that you can also find it through the LAHSA website as well.
Thank
Just to
you.
echo, I'm sorry, this is Anna from DPSS. Just to echo what Sharon mentioned about calling 211. Yeah, that would be the best bet late Friday. They do offer motel vouchers to people who call in requesting crisis housing. And in turn, internally, what happens with 211 and DPSS, every day we receive a listing from 211 with a list of their any motel vouchers issued to participants. So what we do on our end is we clear it on our end to kind of fish out our CalWorks participants to see who requested assistance over the weekend. And once we fish out those participants, again, CalWorks families, we do refer them to our district offices for further assistance. So that's one way that we extend our services when they call 211 over the weekend.
Thank you. Thank you all for those, the information. So we received a question about emergency shelter for dads, or for entire families. But one person in particular asked about a single dad with a toddler. I guess that maybe the concern is that most of the resources are available for women and children, but not for men. Can anyone speak to that?
No, under the it's any family dynamic. It can even be under the coordinated entry system, even if it's adults in the family and one adult is disabled and totally relying on the other adult, they are also able to be served through the coordinated entry system. So again, it could be grandparent and grandchild. It could be two men and a child. As long as there's a minor child under the age of 18, they can be served.
I second that. I can speak specifically to LA Family Housing. We do have family interim housing sites that take dads with children, even if there's no mother.
And on a not quite related, but somewhat related, somebody asked about people who want to bring their pets with them to emergency housing, or how is that handled?
So there are some interim housing sites that accept pets, and unfortunately there are some that do not. So it really just kind of depends. But there are pet-friendly interim housing sites and also shelter spaces.
Do we happen to have a list of that? Does that exist anywhere that you know of?
You know, I'll check, Marlene. I'll check for our spa, for spa 2.
Diana's raising her hand.
I'm currently working on a flyer/list of a bunch of LA County resources for pets and animals, and I'm using there's a really neat search engine that could help you identify pet supplies, shelters, and then free vet or low-income vet services. So I'm trying to find that website link right now, and I could share it with y'all in just a minute. I have to go through all my tabs really quick, but I can make sure to share that out.
Thanks so much, Diana. I appreciate that. So we also received a question about how to help families who they have their income, but they have poor credit scores. What do you usually advise families to do when they're in that situation?
Does anybody want to go? I mean, that's kind of a rough one because unfortunately we can't control landlords and property managers, right? So that's why it's so important in our system to really engage landlords, to create those relationships, to try to get them to reduce those barriers. Sometimes the coordinated entry system can provide incentives to landlords who are willing to overlook barriers. You just really have to get creative, but ultimately we as a system cannot account for the requirements of buildings and units that we're not in charge of.
Hi, this is Anna from DPSS. So if the family is a CalWorks family and are participating in GAIN, I believe one of the supportive services that GAIN offers is a referral to credit counseling. So that's one avenue that they can kind of go through to get themselves on the right path. Again, like Tiffany said, we can't control what the landlords are requesting, but they can request that service through GAIN to begin that process.
And I think that some nonprofits also offer that free service as well. That's right. I forgot about the credit cleanup. That's a great resource.
Thank you. We received a question in the chat, how to help incarcerated parents and their children. I guess this is if when they're coming out of being incarcerated. Are there any special programs for them that you know of?
There are reentry programs. I believe they're called, and please, colleagues, let me know if I'm wrong. Is it the B6? It's either B6 or B7 reentry program. I can tell you in SPA 1, the Catalyst Foundation provides that program. I believe they do it in SPA 2 as well. But yes, there are reentry programs for those who have been recently incarcerated and have been released. And that program is obviously to try to defer homelessness, to try and keep them from ending up on the streets. And of course, it comes with supportive services such as case management and housing and things of that sort.
I'd like to speak to that as well. HOPICS has a reentry program not specifically for families, but for any persons that are transitioning. But also we have Bringing Families Home. And I know that many other spas may have that program as well. And that can assist with reunification.
Thank you. Really good to know. Someone put in the Q&A, I was under the impression that an individual is tied to seek services within the spa from which they last resided. Is this correct?
No, not necessarily. It really depends on, it is client choice. So best practice is for the family to stay where their support system is, whether they're, the kids go to school, where they're employed, where their parents or family is. So that is the best practice, because obviously, the more support you get, the better off you're going to be. But it is the client's choice. If they say, no, I want to put that all aside, I don't want to, stay in this community, they do have the choice to go to another spa, another FSC to seek services.
Sharon's absolutely correct. I would like to say, however, that I have seen the system try to redirect, just like she said, people back to their community. Again, the system is impacted. And so to try to keep from, people from jumping to a spa where they believe there may be more available resources, I have seen the system try to redirect them to quote unquote their own community. But Sharon is absolutely correct. Obviously this population is transient and they go where they can survive best. And so although there may have been a family, that that has roots tied to SPA 2, but it's more affordable for them to live in SPA 1, then that obviously can be done. But yeah, I say that because if there's anybody on here that that's happened to their clients, I want to, just validate that I have seen that happen. And so it just takes a little bit more advocacy, quite frankly. So you need to be fierce advocates.
And I know that there was, I think there were a couple questions about resources outside of the areas that the panelists are presenting on. And there are family solution centers in every spa in the county, and Valley Oasis is the Family Solution Center for Antelope Valley. There were some questions. Unfortunately, they were not available to join us today. But we can send afterwards a list of all the family solution centers for all of the spas. But I know Tiffany has some experience with SPA 1. I don't know if you can speak at all to resources or anything in specifically that you know about services in SPA 1 as well?
Absolutely. Well, SPA 1 is an ever-changing landscape. There's a lot of new providers coming in. Hope the Mission is a big provider. They're out there providing interim housing sites. Let's see, Salvation Army, the People Concern, PATH, People Assisting the Homeless. And then, of course, you know, our homegrown agencies such as the Children's Center of the Antelope Valley Partners for Health. I am familiar with that. I am the SPA 1 representative on the COC board. So I definitely try to stay involved and stay abreast of all the things that are going on in SPA 1. And I live out here.
Okay, getting some more questions and just looking at some more chat questions in the chat. I think this is this might be about maybe this is about families who some parents are not documented. As adults, these children might need assistance themselves. Will this affect them? And then someone else, and the same person asked if they get funded through their children, is there money that the children will ever have to pay? I think maybe they mean repay. Was that, I don't know if whoever asked that question, if you want to clarify in the Q&A. She said yes. Okay.
So when we're talking rental subsidies, as far as I know and to my knowledge in the coordinated entry system and even with public housing authorities, I've never heard of a mixed status family for the children having to repay anything. I've never heard of it or have seen it.
Thank you. And we got a question about SPA 4 services. What is the agency? I don't know off the top of my head that services SPA 4.
SPA 4 is
PATH.
PATH. Okay, thank you.
People Assisting the Homeless.
Yes, okay, thank you. Okay, here's a question that we received in advance, and we've heard this in a few different ways from different agencies. Often, you know, they'll call the agency, try to make a phone call, the home visitor, on behalf of the clients, or the parents make a phone call for housing or shelter assistance, and they really want to speak with a human being, but they often just get recorded messages, and they find that really difficult. Is there any ideas or suggestions about how this can be improved, or suggestions for how home visitors can help their families when this happens to them?
As far as LA Family Housing goes, I believe we have somebody live answering our phone. And then we also have walk-ins every day from 8 to 5. I mean, I would say if you can't get a hold of anybody on the phone, you have to walk in. Again, you guys, this is a very impacted system, and you really have to be a consistent advocate for your families.
And I think oh, sorry, go ahead,
I'm
Regina.
sorry.
No,
I
you go ahead.
second what Tiffany says, especially concerning the walk-in aspect. If you want to engage with a live person, or your client wants to engage with a live person, and your referral isn't being responded to, your voicemails aren't being answered, definitely walk in. I know for HOPICS, we're open Monday through Friday, 8:30 to 5, so.
Okay. And then we got the same question about DPSS. So they call and they can't reach a person, or they don't have the same consistent person that they can speak to. Maybe Anna can respond to that.
Yeah, so a few years ago, DPSS did implement our first contact resolution program, which which took away specific eligibility workers assigned to cases for our families. Before, these eligibility workers had an assigned caseload where these families can call that specific worker for any, question or for any assistance that was required. So now the business process is that our staff have all been cross-trained across all programs available throughout DPSS. And we have 8 open call centers where there are eligibility workers answering the phone. So the point of all this is that, whoever answers the phone is able to answer any question received. We still have eligibility workers in our district offices who process any requests that come through the call center. Unfortunately, our call volumes at the call centers are extremely high. I have heard in previous meetings that it's probably best to call like early in the morning to try to get in as soon as those call lines open, or maybe around 11 a.m. But yeah, unfortunately, that's something that we have been dealing with and have been hearing across the board that our families are experiencing. But they can always leave a message and they will get back to you within 48 hours. And if that doesn't pan out, they can always email. I believe there's an email for the customer service center. I have to check it out, where the managers will reach out, or they'll even email us. I believe our contact information is on the CDSS website, where they can contact CalWorks program, and we'll connect their inquiry. Well, we'll send their inquiry to directly to the district office. However, we do try to stay away from that business process because it kind of overloads us on our end, and that's not the implemented business process. But yeah, overall, it is frustrating on all sides because we have to hear it as well. But yeah, you can call early in the morning or around 11 a.m. I've heard those are the best times to call the customer service center. Or even actually, if they are tech savvy, we do have the Benefits Cal app where they can access case information through that application. They can even apply for benefits on the Benefits Cal app, and just apply for general benefits. Homeless assistance is not available on the Benefits Cal app yet, but they can apply for CalWorks there and obtain case information.
Thank you. This is more of a general question, and it really could be for anyone on the panel. How can we improve the referral pipeline both directions so that home visitors can work with shelters and help their families continue to receive home visiting services? I think one of the challenges that home visitors have is if their clients are, don't have stable housing, obviously the home visit is not the biggest priority for them. But, the home visitors are a great resource for families. So we want them to continue receiving the services. Do you have any suggestions?
That one's a really kind of difficult one, Marlene. I mean, because it's just the system is so unpredictable. I mean, today we might have 0 beds and we may unfortunately have to turn families away. So obviously there's no stability, right? Or they may have a bed. We also have safe parking, as a resource. In terms of the referral process, the real entryway, obviously, to the coordinated entry system is through an access point. And the system is being really intentional right now of trying to increase the throughput so that way we can serve more people, obviously. So it's really concentrating on a system of throughput, right? And the first being the access center. So besides that, I guess in my small world, I'm thinking I'm not sure how that would be able to be coordinated and for there to be a real solid collaboration with the home visitor, especially if the family didn't get into a program. Now, once a family got into a program, absolutely, right? Then we can have care coordination meetings and the whole 9 yards. But while the family is unstable in housing, I think I agree with the home visitor. It makes it difficult.
Thank you. I'm going to go back to the Q&A because there are more questions coming in to the Q&A. Someone asked if a taxpayer number would qualify a parent for subsidized housing.
I have to be honest, I'm not completely sure. If that works like a social security card, then I would say yes. I mean, ultimately, it's up to the housing, ultimately, it is up to the public housing authorities. I mean, at our level, we match to the resources, right? We match to the, whether they're tenant-based vouchers or project-based buildings. But ultimately, once everything goes to the public housing authority, that's where all of the decisions are made.
Okay. Another question we got in the Q&A is, I have a 9-month pregnant client with 3 children who is currently homeless. She has used her 14 days DPSS housing voucher. She needs urgent housing. What would the panelists recommend the home visitor do to help this family?
This is Anna from DPSS. So if she's already exhausted the 14 days temporary homeless assistance that we offer through the state, there's a supplemental county program, TAP plus 14, that it offers an additional 14 days of temporary shelter payments, which works exactly like the Temp HA program she already exhausted. So that's the TAP plus 14 is just an extension to the state temporary homeless assistance program. So if she's already exhausted the state, she can apply for our county supplemental program. And that offers an additional 14 days.
And then just to piggyback on top of that, if she does, get the TAP 14, I recommend that she connects with an FSC as quickly as possible. More than likely, they'll be able to obviously leverage if they get additional assistance through DPSS, but hopefully they have motel assistance available, maybe even a shelter bed. So it's important that she connects with an FSC or access center as quickly as possible in order to receive services.
Yeah, this is Anna again. So if she receives the TAP plus 14 program through DPSS, she can be referred to a homeless case manager. It is a volunteer program, but we obviously stress that our participants take advantage of that program because our HCMs can make that referral to any FSC.
Okay, some of these questions were already answered in the chat, but I'm going to go ahead and voice them out loud and just so that everyone benefits from the responses. So question was for CalWORKs, this is for families only receiving CalWORKs, or can it be for low-income family who is receiving SNAP and trying to move their current home to their own apartment?
I'm not sure I understood that question. Can you repeat it again, Marlene?
I'm reading it as stated on there. So Anna did answer it, but it says for CalWORKs, is this for families only receiving CalWORKs, or can it be used for low-income family who is receiving SNAP and trying to move out of their current home to their own apartment? Maybe they're living with someone else.
Okay, yeah. So CalWORKs offers homeless assistance for our CalWORKs families. Or for any of our applicants who have a pending application on file. They can apply and potentially be eligible to any of the homeless assistance program, which includes moving assistance if they need it. But yes, our homeless assistance programs are only for CalWORKs families who are receiving or pending for CalWORKs.
Thank you.
Mm-hmm.
Another question that came in through the chat, which was answered, but I'll read it out loud. Do any of the services offered support parents who are in the reunification process with their children? So children have been removed from mom's custody, but so the family size is just currently the mom.
Yes, there are family vouchers. They can speak to the social worker.
Okay. Thank you.
Yeah, they can also have their social worker contact 211 for a referral for bringing families home.
Can I also just add one more thing? LASA has a host home program that I'm familiar with. This is mostly for transitional age youth though, so those 18 to 24 experiencing homelessness, but they will house the TAY population who are parents who are maybe still in the in-between of regaining custody of their children or child, to allow them to stay in this host home by whatever kind of provider that there is available, to kind of allow them to stay there for a temporary period of time, in order for them to kind of get their work situated or get their other circumstances in their lives a little bit more secure, in order for them to go back into reunification with their family. So it's, yeah, LASA host home program. Sorry, it was a tongue twister for me. If that applies to anybody, that might also be a benefit.
And Marlene, can I jump in here? Diana just kind of
Please.
juked my memory saying host homes. The coordinated entry system does have a program called problem solving. It is essentially an attempt to divert people away from the homeless system. That is also another option, because as you know, the coordinated entry system is for people who are literally homeless, living in places not meant for habitation. And oftentimes families are couch surfing, or obviously, you know, family members let them come stay with them, or, you know, people help them out. So problem solving is a one-time intervention program that will result in the person or family no longer being homeless or being at risk of homelessness. It is a we can provide financial assistance with security deposits for new move-ins. We can pay a financial stipend for families or individuals that can host the participants or families for more than 30 days. So this program is really like a one-time infusion of financial assistance, if you will, in an attempt to keep the family from being homeless. And it can be such thing as, like, let's say they have a car repair, right? And it's $1,000, and it's, you know, this $1,000 is either going to be to fix their car to get them to work or to pay their rent. That would be an ideal situation for problem solving. It really is focused on people being able to sustain themselves if they get this infusion of money that they need to get over this certain situation. So that problem solving.
And these problem solving programs, are they available in every through every family solution center?
They should be available in every SPA, yes.
Okay, great.
And let me just also say, historically, they've run out of funds, right? However, I can tell you that the system is putting more money into it this year, and the problem solving programs are beefing up. So if you ever had a family that was turned away, I would say maybe try again, because this is a new fiscal year. And from what I understand, I believe that budgets have been increased.
Okay. Somebody put in the chat, if a parent has LAUSD students enrolled, we may be able to offer 5 days of temporary short-term housing. We will then ensure she is connected to a CES. I'm not sure if this was a question or... Oh, Denise Miranda is sharing this information. Thank you, Denise, from LAUSD. Thank you, Denise. I appreciate that.
And then let me also say about LAUSD too, is that they are going in partnership with developers. And so they have buildings that are coming up that are geared towards LAUSD families, just like Sun King that just opened. So that was really nice. So thank you, LAUSD.
Yes, thank you. And great resource to know about that. Okay. All right. Okay. Here's a question that came in the chat. I have a 16-year-old Guatemalan undocumented teen with a 6-month-old child. She's living in a church. What types of housing services can she get?
She needs to go to a transitional age access center, transitional age youth access center. What SPA is that?
Marina, can you tell us, can you type in the Q&A what SPA your client is in? Let's see. I don't see anything yet, but I will go back to that.
That's okay. Actually, Marlene, let me jump in and say that, you know, if you're ever looking for who is the lead coordinated entry service agency in your area, you can always go to LASA's website. They have great directories just in their search bar, lead agents, CES lead agency, SPA 2, SPA 3, whatever. It'll pull it up, and actually it'll give you a whole list of all the lead agencies, the regional coordinators, the regional directors. It has some really good information on there. So if you want to go in the LASA website and just start searching around, it'll tell you where a lot of these places are.
Okay, could someone please just plop the LASA website in the chat? Okay. Someone mentioned Lost of Home program, how they get in contact.
The host home program, you mean?
No, they said LOST of home. Is anyone familiar with that program?
LOST home, no.
No? Okay. We
Yeah.
can maybe Google that and find out what that means. Okay. Lots of questions. Okay. All right. And I know that Anna answered this one in the chat, but I think it might be helpful to others who have a similar situation. What happens to a person who submits an application through CalWORKS, has a pending application, receives some services while the application is pending, then ultimately does not meet the criteria for CalWORKS housing resources? Anna, would you mind responding to that verbally?
Yeah, so if a family has a pending application on file and they're ultimately denied because they don't meet the eligibility requirements to CalWORKS, but received homeless assistance benefits while their application was pending, their application is just simply denied and closed, and they are no longer eligible to receive any of their of the other programs or benefits that CalWORKS offers.
Thank you. All right. All right, this one I think may have been somewhat answered, but I'm going to ask it again because I feel like there's just so much information being presented and provided that I want to make sure we capture responses to all the specific questions. Are there resources available to help families who can afford the monthly rent, but they don't have enough money for the deposit, which is often double or triple the rent?
Yes, problem-solving program.
Okay.
So, yeah, go to your, whatever spa you're in, go to your lead agency in that spa. And Marlene, I dropped that link, the Access Center directory in the chat, but go to your lead agency in your spa and tell them your situation and ask, you can ask for their problem-solving specialist, and then that'll start the process.
Okay, and I think that the chat is just for the panelists and these staff on our team. So I think I'll go ahead and put that. I'll just drop, see if I can drop. No. Okay. I'm not sure how to do that, to drop a question in the chat myself. Someone asked about sorry, I was looking at a question and it just disappeared on me. It was about clients seeking asylum. I think Melina was typing a response to that. Melina, do you mind reading that question and responding to what you were going to type?
Yes, so the question was if a client who is in the process of asylum be able to receive this assistance and affected in any way by receiving this assistance. Will this affect their asylum process in any way? And so I was just sharing in the Q&A, I added 2 resources, which are the Baila Network and the Office of Immigrant Affairs, of course, to share with clients. They'll be able to provide information and offer legal referrals to assist with their specific questions and situation. And if anybody else wants to jump in and address this.
Anna has her hand up. Anna, is that response to this?
No, but I did have a response for the previous question asked in regards to the family who can afford housing but cannot afford to get into the housing. So DPSS CalWorks does offer a permanent homeless assistance program, and that program does assist our CalWorks families secure that permanent housing by covering the last month's rent, security deposit costs, and utility turn-on fees for gas, electricity, and water. The main eligibility requirement to this program is that their rent for that permanent home that they have secured cannot exceed 80% of their total monthly household income. So it has to make sense for the family as well, where we don't want them to be back into that situation where they're at risk again. So that's the main eligibility requirement that some of our families are having a hard time meeting. But that program does exist within CalWorks, where we do assist our CalWorks families with those security deposit costs.
Thank you. Okay, let's see. Still have some open questions, so I'm looking through them. I think we've answered most of the questions that have been floating in. I'm going to look at my list of pre-submitted questions to see if there's anything that hasn't been addressed yet. Someone asked how to help a family living on cash aid and CalWorks afford a place to live with their children.
I'm willing to jump in there, Marlene.
Thank you.
Guys, listen, the real reality is that we're not going to build our way out of unaffordable housing anytime soon. There was a study that was done, and we are short 500,000 units in LA County. That goes for everybody on this panel, me, you, working people, homeless people, everybody in general. We're short 500,000 units. I keep telling people, as housing prices increase, as inflation increases, we are going to see more people fall into homelessness. I see families every day who both parents are working and they just can't make ends meet. And the unfortunate reality is there are not enough resources to go around. I mean, I liken it to the Titanic movie, right? When neither like Rose, there are not enough boats here, you know? That is how we are in this housing crisis. I can tell you right now, we are housing more people than the system ever has before, but we can't account for the people who are falling into homelessness. So as much as we're trying to, infuse all these prevention programs, the reality is that there's just not enough. So what we really need to do is we really need to become hope dealers for our families, for our individuals. We need to get them thinking about how to increase their income. Is it going back to school? Is it learning a trade? Is it thinking about multifamily housing again, shared housing? We have to get creative. I can tell you when I was a home visitor, one of my biggest things was landlord engagement. I kept my landlords in a gold little pocket, and I protected them like they were gold. You know, one instance of that is, you know, I had a single mother who had 9 children under the age of 18, and they were not the most well-behaved children. And I was able to house them because I had a relationship with landlords. And so that is just old-fashioned knocking on doors, having those conversations, because there are a lot of people who want to be part of the solution, but they don't know how, right? So talking to people, church members, your congregation, about opening up their homes, you know, do they have a spare bedroom or 2 in their house that they might be willing to rent? We have to get creative if we're going to help families, if we're going to help people, you know, stay out of homelessness. Because again, the reality is we are not going to build our way out of this anytime soon. And the only real solution is affordable housing.
Thank you, Tiffany. And I know there's a lot of organizations out there that are working on this, that are trying to address, you know, the preventing the loss of housing that is currently affordable, and building and subsidies. And it's a lot. It's kind of overwhelming. But I thank you for sharing that. And I thank all of the panelists for all of your expertise and for your time. And I think at this point, we're going to hand it over to Melina, who is going to walk us through the Affordable and Accessible Housing Registry. If our panelists wouldn't mind staying on for a few more minutes, just in case anything else comes up, you know, and when we're in closing, that would be great.
Marlene, can I add one thing really quick?
Absolutely.
Just for any type of program, any type of system, I would say that one of the biggest barriers that I see for families is not being document ready. We have this whole thing right now about talking about being document ready, right? Parents having a valid ID, having social security cards in hand, having county birth certificates, not hospital birth certificates, not, you know, abstracts, but having county birth certificates in hand and being document ready to be able to be housed and to enroll in programs. So if I could give, you know, any advice to home visitors, it would be, please help your families get document ready. So that way, when and if they need to access one of these programs, they're ready.
Great point. Does anyone else have any like final like pearls of wisdom, pieces of advice? I saw Anna come off mute. Please feel free to share. We have a few minutes.
Yeah, same as Tiffany just mentioned. On the CalWorks end of that is the same thing, but we receive all those documents at the forefront when they're applying initially for CalWorks. But in regards to homeless assistance, if they're coming in to apply for benefits, again, being document ready, having their rental lease agreements with them, or if they're at risk of becoming homeless, an eviction note, any type of verification that can verify their current situation. If they have that in hand, that'll speed up the process as well.
Thank you.
Mm-hmm.
I'll give a moment to see if any of our other panelists want to jump in with some final pearls of wisdom or thoughts. Okay, I'm going to hand it over to Melina. And again, Melina is my co-lead for the Referrals Workgroup. She works for Maternal Child Health Access, and she is going to provide an overview of the Affordable and Accessible Housing Registry. Thanks, Melina.
Thank you, Marlene. Thank you. Thank you, everyone. Thank you, Tiffany, Anna, Diamond, Sharon, Diana, for staying with us here till the end. Eric as well, and Regina, thank you. Thank you for still being here and for your help answering all the questions in the chat. I'm just gonna quickly go over another resource that can be helpful for the housing search. If you're not familiar with it, this is a good tool, a good resource, and additional resources will also be shared. They'll be emailed to you, and I'll go over those briefly as well. But this is the City of Los Angeles Affordable and Accessible Housing Registry. For anyone who who's not familiar with this, this is a good resource to search for housing. Anyone can search for housing using this this website. it lists affordable housing available throughout LA, including the Valley, San Gabriel Valley, Wilmington, San Pedro, West LA, and it's a good resource to use to be able to learn about upcoming applications, upcoming lotteries, apply for those upcoming lotteries for new properties that are available, as well as to join wait lists and apply for as many wait lists and help clients to apply. So it's fairly easy to navigate. Anyone can begin their search by just going on, beginning their search, and you'll be able to, quickly see all of the different properties that are available here on the right-hand side. As you can see, there are different, the properties come up. You can also search and filter out results based on spa, based on the type of, whether a housing is accepting open for lottery applications. And what that means is that the building is vacant. It has not filled any units. And so they have a lottery application open, right? And so clients can apply to join that lottery and have a chance at obtaining a unit, as well as they can join wait lists that are opening up. Like I said, anyone can search. An account is not required to search, but definitely signing up for an account is helpful. It's very useful for searching, because by signing up with an account, and that just setting up basically with your email, a password, basic information, there you'll have an account, and you'll be able to receive email alerts whenever a building has opens up their wait list, and so you can apply right away as soon as you receive those alerts. If there are any available properties that have a lottery application available, you'll be able to see those as well. And so the one I want to share with you today is the Red Tail Crossing. I'll go ahead and click on it here. Whenever you click on the property, this is like the page that you want to go to. That's gonna have all of the information there to assist your clients apply for this housing. If a client has an account, you'll be able to over here click the apply button, and they'll be able to apply. Again, you have to be logged in. Like, I have a little pop-up here. I am not logged in. So they'll be able to, once they're logged in, they'll be able to apply and join that lottery to be able to see if they'll be, they'll be selected for a unit. And so they can, download the marketing flyer. The marketing flyer will have all of the information, including where they can apply online, how to print an application, and where to submit the application. And so we'll go ahead and I've already downloaded the flyer and the application for you, and we'll be sharing those out with you. But please, what I recommend in terms of, how to use this tool is registering yourself for an account, and then, letting clients know as you're getting those email alerts. You can print out the applications for clients that maybe access is an issue, and you can provide it to them, or you can walk clients and actually show them how to register themselves and how to search, maybe walk them through a search, and walk them through on how to add themselves on a wait list. we don't have time to go over all that right now, but it's fairly easy to navigate the website. Like I said, you just creating an account, it's pretty simple. But definitely, this is something else that you can share with clients. And you'll receive that information for this particular Red Tail Crossing. Is a building in the southwest. If you're familiar with the area, 90045, and you can see the map here is over there in the southwest. La Tejera, 83rd Street. And this is a brand new building. The application is for the lottery. So this is not a application for an actual unit. So just clients, just need to share that with clients that some of these, they're lottery, and they need to also be just document ready, because if they are, let's say they are selected for the lottery and they're, high up in the lottery, they need to be ready to apply for one of these units with all their documents, proof of income, all their identification documents. And so it's really very important to support clients with that as well, as much as we can. And also utilize the resources that are available. I mentioned earlier that we'll be sharing a couple of other resources, and that includes there's the Project Place, a Project Place listing resource that I share with Anna. She'll be emailing that to you guys, but that's a really great resource that includes other ways to search for affordable housing in LA, as well as really helpful information to where to report housing inhabitability issues, such as like environmental issues with LA Public Health. All those links are in that document as well. So thank you. I'll go ahead and I'll stop sharing now. Please, check this out if you haven't used it already, and yeah, sign up for an account.
Thanks, Melina. Can you read out loud just the name of the URL for the website?
Yes, so that is lahousing.lacity.org. And when you go there, it'll take you directly to that homepage.
Great, thank you. Somebody asked about the documents usually asked to inform their clients when they're seeking housing. Do we have a list of those documents somewhere? And this is really for any of the panelists.
Well, it kind of depends on what program they're talking about, Marlene. Like, I'm sure like the county, like Anna said, they have similar, but for permanent supportive housing and being in the coordinated entry system. Now, remember, this is another thing I wanted to emphasize, is that the coordinated entry system, again, is for people experiencing literal homelessness. Like, again, a place not meant for habitation. So if a family goes into a coordinated entry access point and says that they're homeless, but they're living with somebody, they won't qualify for services because they're not literally homeless as defined by HUD and where we get our funding from. So if the family is in the coordinated entry system and they're looking at that, then it would be a valid ID for all adults, a social security card, a birth certificate for all the children, a county birth certificate for all the children. And yeah, and that's it.
Thank you. And thank you so much, Melina, for doing that walkthrough. That was so helpful. Really appreciate it. I think we're gonna pass it over as point to Laurel, who's going to help to do a Mentimeter and help close us out today. Thank you.
Yes, thank you so much, Marlene, and thank you to all of our presenters today. This is such a great wealth of information. I really appreciate everyone's time. We want to start wrapping up our presentation today with a quick Mentimeter. So if you could all go to www.menti.com, I put that in the chat. The code is 8747. 9870. And we have one question for you, and that is, what did you observe or learn through today's discussion? Let me put the Mentimeter up on our screen for us so we can all see. And if you all could just take a minute or two, let us know what you learned from this great presentation today. Is everybody able to get in there? Is our Menti working? Oh no. Oh, thank you, Cindy and Elizabeth, for confirming that I'm screen sharing appropriately. All right, now we've got stuff coming in. Thank you guys so much. So people are saying the resources available in our community, the resources are available.
I learned the importance of having documents ready. Yes, that is very, very important. I learned about BILA and the search function for LAHD and the need to be an advocate endlessly. That is very true. So much wealth of information to share with families. It is a complex system, but we are going to continue to advocate and provide hope to all of our families. I really love that. Thank you, whoever said that. That's great. I liked that I know undocumented families do get help because kids are born here in the US. Someone shared that they understand the coordinated system a little bit better. Someone else said they learned what families should expect when accessing these resources. Oh, thank you guys. I'm getting a lot of great info here. I'm not gonna be able to read everything, but I'll do my best. What I learned from this meeting was many ways that we can provide to help our families regarding housing, making sure that they have all documentation ready, the available resources we can use for our clients. Lots of people saying that they learned the importance of having their documents ready, and that makes me very, very happy. That was something that came up a lot. That question came up a lot as you were registering, so I'm really glad that that all stuck out in your minds. Someone said learned about the different resources and how they work. Great resource for our communities. I learned that Antelope Valley has catching up to do. I appreciate your candor with that. Someone said then this is sadly true. We have insufficient help for lots of people. But that's why we continue to work at this and continue to provide hope for people. Someone said there's not enough housing for everyone, but plenty of resources for temporary housing. More resources available for our families trying to navigate the CES system. Be document ready again. Yes. Someone also said the cruel reality of the current crisis for housing. It is important that we are aware of the reality of these situations. That's how we can better help our families. Great information to share with our clients. The housing shortage is a national, international issue, but yes, there is help out there, and there are new resources for home visitors. Wow, thank you guys so much for this. We can send this out with the follow-up materials as well. Someone else said, oh, this is great. Walk-ins available for services with HOPICS. I've bookmarked all of your websites to have ready for my clients. Thank you. That makes all of us feel really, really great. Thank you. And someone said, I'll end up with this. Someone said they learn to be optimistic and creative when working with families in crisis. Amen. Thank you guys so much for participating in this Menti. I'll leave it open if anybody wants to add anything else. Like I said, we'll save this and share this out with the documents after the webinar. But for now, I will stop screen sharing, and Anna is going to put up a QR code for you all to take our brief survey. Thank you so much. Lynette's going to share it. I'm sorry, not Anna. Thank you. Here we go.
Marlene, can I jump in real quick?
Absolutely.
Housing authorities, you guys, HACLA, the housing authority for the city of Los Angeles, and also LACTA, the Los Angeles Development. I know they changed their name, but that's for the unincorporated areas. Go to those websites. They will tell you where their low income housing is, where their low income buildings are that are not related to coordinated entry system. Those are just typical low income housing buildings. You can get your participants on waiting lists. You can sign up for notifications so that way you know when new buildings are coming online or when the waiting list opens. So that's another great resource, is knowing the resources from the Public Housing Authority.
Can you say what those are again?
Yeah, absolutely. One is HACLA, HACLA. That's the Housing Authority for the City of Los Angeles. And those are usually for cities. And then the other one is LACDA, LACDA. And I apologize, you guys, it's something like Los Angeles County Development Authority or something like that. But that is for the unincorporated areas. So that's our big one in SPA 1. And like I said, those, the Public Housing Authority websites have all the low income buildings that they, that's in their portfolio. They manage the waiting list, the regular Section 8 waiting lists. And you guys, just if you guys have ever heard that, the waiting list is a 10-year wait, I want you to believe that. There are other programs and, vouchers coming into the system that we're trying to expedite, but typical Section 8 waiting list is a very long waiting list. I'm hoping that throughout the years it's gone down, but yeah, Public Housing Authority website, guys. And then landlord engagement, remember, network, landlord engagement.
I love your enthusiasm with your advocacy, Tiffany. I love it. How long will we have this link open for the evaluation?
Hi, Marlene. I can answer that. Sorry, I forgot to put my mic down. We'll have it open for a few days after, but if you have a chance, please take the evaluation now. It really helps us to better understand what the needs in the communities are. I know, of course, this webinar came from our Referrals Workgroup Barrier Survey, but we do have a question on there that asks you all what you want the consortium to put on next. So it's really valuable information on our end. And again, thank you to all the panelists for participating today. And I hope that everyone learned something new today.
Thank you.
Thank you, everyone. Thank you for joining us today.
Thank you, everyone.
Bye.
Thank you.
We'll keep the evaluation on for a few minutes longer, but again, thank you all so much for joining us today. I hope you all have a wonderful rest of your day.